last video, this is the postpartum assessment. Here's the den, and let me get this situated. Alright, so I am knocking and entering. Hi, Mrs. Stark, I'm Christine. I'm going to be your nurse today, and I just have to do a little postpartum assessment. How are you feeling? Alright, do you mind if I see your wristband? Great, can you tell me your date of birth? Perfect, okay. So I'm going to sanitize and put gloves on. Universal precautions. I'm getting this bed to where I don't have to hurt my back to assess her. She can be sitting up for this part. And alright, first I have to check your breasts, okay? So I'm going to just pull your gown up for just a minute, or pull it down, actually would provide for more privacy. Checking for engorgement, any lacerations, any bleeding, cracks, sores on the nipples. I'm going to feel a circular motion. Alright, that is breath. Now I just have to listen to your lungs and your heart. So just kind of listen. Okay, I know you're sore. Can you lean forward for me just a little bit so I can listen to your back? Thank you. Alright, and while you're setting up, are you having any flank pain? I'm just going to tap right here. Is that any more sore when I do that? Okay, thank you. And I need to check bowel sounds, the fundus in the bladder. So I'm going to listen to your belly, just see how your bowels sound, make sure everything's moving. Great. And I also, when I first came in, I could have started with vitals, but I could do them now. So I'm going to get your blood pressure and make sure it's staying around your norm baseline from prior to birth. And your temp. And I listen to the apical pulse for 1 full minute. Feel your pulses. Can you squeeze my hands? Can you push them away? Great. Okay. Now I have to lay you all the way flat. I assess your uterus and your bladder. I'm gonna hold here at the symphysis pubis and feel. And she's about 12 hours postpartum. Her fundus is right at the umbilicus. All right. And feel for any bladder distension. The fundus is midline, and the bladder is also midline. All right. Now I just have to have you roll away from me. I'm going to look at your back, at your site from your epidural, and check a few other things. So, rolling, I'm checking the epidural site. I'm checking for any hemorrhoids. I can check the episiotomy, depending on the grade that she had. I assessed the kidneys already. And next I am going to, you can sit back up now. I need to assess her genitalia. Again, check for the episiotomy, make sure that it is well approximated. Need to check the lochia for the color, odor, consistency, and amount. Now, your pad is pretty red or bloody. How often have you been having to change that? Okay, but no more often. You're not having to change it like one time per hour or more, right? Okay, great. Just let me know if that changes. And then I am going to look at the extremities. I'm going to check for edema. I'm going to feel these pedal pulses. And, all right, is there anything else I can do for you, Mrs. Stark? No? Okay, I'm going to give you your call light in case you do have any questions or anything changes. Please let me know if anything starts to feel weird or abnormal, or if you need anything. And so you have your call light. All right, so let me know if you need anything or have any questions. Thank you. Now I can undo the curtain and open the door, have my gloves thrown away, I'm hand sanitizing, and I'm good.